This clinical presentation will be focusing on borderline personality disorder. The mental illness borderline personality disorder, also known in shorthand as BPD, will be explained and debunked in this clinical presentation. We will learn to differentiate between BPD from a diagnosis that have similar symptoms. Treatment for this diagnosis is possible, and we will discuss on the different options available. Have you ever heard of personality disorders? They are a type of mental disorder that can affect a person's life in profound ways. Today we will explore what personality disorders are and what they're not. A personality disorder is a mental disorder that involves a rigid and unhealthy pattern of thinking, functioning, and behavior. It can be long-lasting and cause significant distress and impair a person's ability to function. Cluster A personality disorders are called the odd eccentric cluster. These disorders include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. They are characterized by social awkwardness and social isolation or withdrawal. Cluster B personality disorders, on the other hand, are characterized by difficulty regulating emotions and behavior. People with these disorders may appear dramatic, emotional, or erratic. The four cluster B disorders are antisocial, borderline, histrionic, and narcissistic personality disorders. Let's take a closer look at borderline personality disorder, or BPD. There are many myths about this disorder that need to be debunked. Contrary to popular belief, BPD does not mean lack of empathy or a desire for social distancing or avoidance. It is also not a dangerous disorder, nor does it mean someone is manipulative or attention-seeking. It is true that women are more susceptible to developing BPD, but recent studies indicate that men are just as likely to develop the disorder. However, men are more likely to be misdiagnosed with PTSD or depression. BPD is characterized by ongoing patterns of emotional dysregulation, unstable relationships, and self-image issues. Treatment for BPD involves therapy such as dialectical behavioral therapy and medication management. In the early 1900s, psychoanalysis was a relatively new field, and as researchers delved more deeply into the workings of the human mind, they began to discover new forms of mental illness that did not fit into the existing diagnostic categories. One such disorder that emerged in the 1930s was borderline personality disorder. Hungarian-American psychoanalyst Adolf Stern was the first to notice this new group of patients who appeared to border on the line of insanity. They were prone to extreme emotional outbursts and quickly escalated to erratic behaviors. In 1947, further research was conducted which stated that those with BPD lived in a constant state of chaos. Treatment for these patients were inconclusive and they were often locked away in asylums. By 1952, it was proposed that borderlines had no sense of self and when under pressure would crumble. This model would stick around for a long time and can still be traced into today's ideologies surrounding borderline personality disorder. In the 1960s and 90s, by the 60s, research into BPD continued with the discovery of splitting by Otto Kernberg. He proposed that individuals with borderline have been unable to overcome the good mother, bad mother dichotomy, which first experienced in infancy, and as a result split themselves and the world in half. This led to BPD patients seeing all relationships in extremes, leading to relationship chaos as well as cognitive, emotional, and behavioral instability. Despite lacking substantial evidence, Kernberg's ideas remained influential and compelling in the field of study. However, during this time, mental health was tied to misogyny, and BPD was considered a condition tied to the myth of female hysteria. As of today, over the years, there have been significant progress in understanding the treatment of BPD, especially since the entry of women in the field of psychology. The myth of female hysteria has been debunked, and BPD is no longer seen as a feminine disorder. Today, treatments such as dialectical behavioral therapy have been shown to be effective in reducing symptoms of BPD, and research continues to help better understand the disorder and improve treatments. While there is still much to learn about BPD, the progress made over the last several decades has given hope to those living with the disorder and their loved ones. What causes BPD? Let's take a closer look at the factors that contribute to this disorder. Research suggests that BPD has a complex set of causes. One factor may be genetics. Studies have shown that BPD may be more common in families with a history of mental health issues. However, Genetics alone do not determine if a person will develop BPD. Environmental factors can also play a role in its development. Childhood experiences such as abuse, neglect, or trauma can increase the risk of developing BPD. People who grew up in unstable or chaotic environments may have a higher risk as well. Another factor that can contribute to BPD is brain abnormalities. Studies have shown that people with BPD may have structural and functional differences in their brains. Specifically, the part of their brain that regulates emotions, impulse control, and decision-making may be affected in people with BPD. These differences can make it harder for people with BPD to regulate their emotions and their behavior. It's important to note that a combination of genetic, environmental, and brain-related factors can lead to BPD. However, not everyone who experiences trauma or has a family history of mental illness will develop BPD. This disorder is complex and can be challenging to diagnose. We will now discuss the symptoms of BPD and how it impacts those diagnosed with the disorder. One of the hallmark symptoms of BPD is an intense fear of abandonment. People with BPD may engage in extreme behaviors to avoid real or imagined separation or rejection. This symptom can cause significant distress in personal and professional relationships for individuals with BPD. Another symptom of BPD is a pattern of unstable, intense relationships. Those with BPD may find themselves idolizing someone one moment, then suddenly believing that that person doesn't care enough or is cruel. This symptom can make it challenging to maintain healthy relationships. Rapid changes in self-identity and self-image are also common in people with BPD. They may shift goals and values quickly and go from seeing themselves at the top of the world to seeing themselves as bad as it or as if they don't exist at all. This symptom can lead to feelings of confusion and difficulty making decisions. Periods of stress-related paranoia and loss of contact with reality are also common in those with BPD. These episodes can last from a few minutes to a few hours. This symptom can cause significant distress and impact daily functioning. Impulsive and risky behavior are also common symptoms of BPD. This can include reckless driving, spending sprees, or drug abuse. Individuals with BPD may engage in these behaviors in response to fear or separation with rejection. Suicidal threats or behaviors and self-injury are also common in people with BPD. These behaviors can be a response to fear or abandonment or may be used as a way to regulate intense emotions. Mood swings lasting from a few hours to a few days are also common in people with BPD. These swings can include intense happiness, irritability, shame, or anxiety. This symptom can make it challenging to manage emotions and maintain healthy relationships. The impact of BPD can be significant. Repeated job changes or losses, not completing education, or involvement in legal issues such as jail time can result from BPD. Additionally, people with BPD can experience conflict-filled relationships, self-injury, and frequent hospitalization or abusive relationships. People with BPD may engage in risky behaviors that can lead to unplanned pregnancies, sexually transmitted infections, motor vehicle accidents, and physical injuries. The symptoms of BPD can make it challenging to maintain healthy relationships, affect daily functioning, and lead to risky behaviors and consequences. Effective treatment for BPD, such as therapy and medication management, is essential. To diagnose borderline personality disorder, a mental health professional will refer to the DSM-5 criteria. Let's take a closer look at what that is. Firstly, a pervasive pattern of instability in interpersonal relationships, self-image, and emotions must be present. This pattern is manifested by episodes of intense and unstable emotions, impulsive behavior, and frequent changes in self-identity. Secondly, the individual often has extreme fears of abandonment and may engage in frantic efforts to avoid real or imagined separation or rejection. They may also experience chronic feelings of emptiness and may engage in self-injurious behaviors such as cutting or burning in response to stressors. Thirdly, individuals with BPD often struggle to regulate their emotions and have intense mood swings that can last from hours to days. These mood swings can also result in dissociative episodes or feelings of being disconnected from oneself or one's surroundings. Fourthly, individuals with BPD may experience a significant disturbance of their sense of self, leading to confusion about their goals, values, and identity. Additionally, they may have distorted perceptions of themselves, others, and the world around them. Finally, The individual must meet at least 5 of these 9 symptoms previously mentioned in the prior slide. Although borderline personality disorder is a well-known mental health condition, its diagnosis can often be confused with other disorders, ultimately leading to incorrect treatment. Bipolar disorder and major depressive disorder are often misdiagnosed when compared to BPD, as they lack the pervasive pattern of instability that is present in BPD. Bipolar disorder is differentiated by episodes of mania or hypermania, while major depressive disorder pertains to persistent sadness or loss of interests. On the other hand, complex post-traumatic stress disorder and anxiety disorder can have some overlapping symptoms with BPD, such as restlessness, irritability, or fear of abandonment. However, CPTSD is mainly associated with repeated trauma, while BPD is characterized by chronic impulsivity, instability, and self-image disturbance. Anxiety disorders focus mainly on anxiety-related symptoms such as panic attacks, generalized worry, and stress. There are various forms of therapy available for individuals experiencing BPD. Let's discuss some of the most popular ones. Dialectical behavioral therapy, otherwise known as DBT, is a type of talk therapy designed to help individuals regulate emotions, manage stress, and build healthier relationships. It emphasizes on improving interpersonal relationships, integrating mindfulness practices, and emotional regulation training. Mentalization-based therapy, also known as MBT, is a form of talk therapy that views mental health conditions as sometimes arising from the inability to shape and understand written and unwritten communication with others. It aims to help individuals develop a mental life map or plan to help stop harmful thoughts and behaviors. Schema therapy is a talk therapy that focuses on maladaptive schemas or patterns developed from past experiences. The therapy helps individuals identify and challenge these negative schemas or beliefs to change their ways of thinking. Transference-focused psychotherapy, otherwise known as TFP, is a form of talk therapy that emphasizes the relationship between the therapist and the individual. It aims to help individuals identify unhealthy patterns in relationships and work through them in the therapeutic relationship, ultimately changing their patterns in other relationships. Systematic training for emotional predictability and problem solving, otherwise known as STEPPS, otherwise known as STEPS, is a structured group therapy program that brings together key skills from different types of therapy, helping individuals manage borderline disorder. It aims to teach individual problem-solving skills, emotional regulation, and teamwork in a group setting. And that sums up this clinical presentation on borderline personality disorder. I hope you found this video informative and helpful. Always remember that research in this field is constantly expanding and to always stay updated on the latest findings on borderline personality disorder. On the next slide, there will be a list of references used to create this presentation. Thank you, and I hope you enjoyed. Have a great day.